So in this lecture, we'll see some forces and related
फोकस नहीं आ रहा है इसका
which lead to some fracture pattern.
संदीप हाँ अब सही है ओके
Hello.
सही है ओके ओके स्टार्ट
Type of forces and the fracture pattern associated with this and method. Method. Force forces are of one is called as intrinsic, one is these are also known as physiological forces, and these are also non-logical. So there intrinsic or physiological, one is extrinsic or these forces how they are the animal or weight, weight. And second muscle like physical activity. So two type of forces, one is physiological and one is the these forces are generated by the body weight of the animal, that is weight bearing, or by the muscle contraction during some physiological activity. What are non-physiological accident like fall from a height? These are the non-physiological. Muscle contraction. They are transmitted joint surface through joint surface and muscle contraction. These forces they are transmitted to how they are transmitted. That may lead to fracture. So two types, intrinsic or physiological, which is wearing of animal, or muscle contraction. They are transmitted to the bone via joint or muscle transmitted to the bone, and they may lead to fracture. In these cases, usually, but some cases they may be causing fracture. So from the intrinsic or physiological, I will explain example from muscle contraction and generated by muscle contraction, and it is transmitted to the bone via muscle contraction, and that may lead to fracture. So first we see how one physiological force that is generated by example is avulsion fracture, and what is which is force is the tension force, which is also force. It occurs. So answer is origin or insertion in bone. For example, this radius and the process, polycranial process. If we suppose this is the animal humerus, which is having radius and some muscles taking origin from here and they insert at this. So olecranon process muscle inserted via tendon. When this muscle contract because of tension, what it causes fracture bone. Then fracture where muscle is inserted. Force is the pulling force generated by the where it where there is insertion of the tendon. It pulls because of muscle contraction. It take the piece of bone. This is called fracture. Then method that is known as tension band principle. Tension band wiring. What is this principle? This principle convert tension force tension force into pressure. Figure it will compress. Force is converted in. This is the principle of fixed. The topic here is we are studying intrinsic physics. Tension force. It remove the where it how tension band principle converted into the compression force. Voice is clear, na? Hello? Intrinsic force, we explained muscle that was the Wilson. Extrinsic force, direct bone, directly to bone. These are of five types. Best TEC. You need to remember it. So these are the five forces. Right. This force will some pattern. This force will cause some other pattern, and this force will cause some other pattern. So we'll see what are these five type of force pattern. So out of intrinsic forces or physiological forces. How to remember these five forces? Five in number. The trick is best technique on choose to choose best technique to neutralize all the forces acting acting on a fracture line. This is this trick is best technique because we want to choose the best technique to neutralize all the type of forces which are acting. So what is this best technique? Now, best BE, that is the bending, that is the bending force. That is the bending force. Because of this bending force, here force, here fracture pattern, fracture pattern. So bending force transverse fracture or without fragment. Fracture, this is the bone, this is the first fracture. So the name of bending force pattern is the transverse fracture. Why it is written with or without butterfly fragment? Because If we combine bending plus compression, then again transverse fracture is there. It is with some butterfly fracture. Butterfly fracture. What is that? Suppose fracture is transverse, but here one this is called transverse fracture when it is occurring when bending plus compression both forces are transverse fracture with butterfly fracture. If only bending force, no butterfly fracture. Number out of best S is there. S shear force. That is shear force. So what is from the name itself we can remember SH pattern will be short oblique. Pattern will be short oblique. The meaning of short oblique. This is the bone and this is the fracture. It means this is fracture line. So fracture line angle is more than 30 degrees with the long. So when this angle is more than 30 degree, we short oblique fracture. Short. Why it is occurring? Because this SH is because of SSCR force. In our mnemonic best technique, B is bending force, SH, then T. Next will be number 3. T for torsion. T for this may lead to long oblique. It is also called as spiral fracture. This is the bone. This is the bone. The fracture will be S-shaped. Means fracture line will be line. This is the fracture spiral. So what is the force responsible? Known as rotation force. It is also known as rotation force. This long oblique or it is called spiral fracture. In this fracture line is having angle less than 30 degrees. This with long axis bone less than 30 degrees. TE from the base technique number 4 is TE. T tension. Tension means like this. It's pulling on both the sides. T for T. It will lead to again transverse. It will lead to transverse fracture. Last C. Number 5 forces C. C for compression. C for the compression. If you compress from both the sides, compression. The pattern of fracture will be short oblique. pattern will be short. So if I summarize all five forces, these are extrinsic, these are physiological forces. They are transmitted directly to the bone. What is there? Remember, best technique. What is BE? Bending. What is S? T? Torsion. And TE is tension. And C is the compression. So these are five forces. They may lead to pattern transverse fracture without any butterfly fragment, short oblique fracture, and torsion may lead to long oblique fracture, which is also called as spiral fracture. And tension may lead to T for T, transverse fracture. And again, short oblique fracture. If we if we combine, so combine force to comminuted fracture. That may lead to comminuted fracture. So this is the trick, the best technique. We want best technique to neutralize all forces. And we have that technique to neutralize all five forces. So next, what is this that best technique to neutralize all forces? So here fixation technique, and we want this to be the best technique. What is the ESF? External skeletal. That may be linear or that may be circular. Second, bone plate. Bone plate. Interlocking nail. One more, plate plus rod. So these techniques, they will neutralize all the five forces. That's why they are the best technique. They will neutralize all the forces. Number two is external coaptation. What is the meaning? Like your POP, like your fiberglass, like your splint, Tamer splint, ST splint, all these splint. They will E, bending force, bending force. But they will utilize torsion force. But this is other forces they cannot utilize. Number third, single IM pin asked in your LDO 2019. IM pinning, which is single IM pin, can utilize. So your answer should be first two. Other forces it cannot utilize. And out of these two, bending is most important answer. The partial, but it can utilize two. Instead of single pin, if I take multiple pin, multiple, uh, the technique is called stack pinning. Stack pinning. And instead of two, this technique can utilize three. 1, 2, 3. Neutralize last two. If I take cross, if I take cross spin, it is more important. It will one, oh sorry, three here. It will neutralize four forces. The last. Then last is tension band wire. As the name indicates, tension. Like this TE, only tension force, not any only tension. So these are example of which will neutralize. If they are best, so they will neutralize the best force. The best technique will neutralize these all forces. Neutralize bending force and partially this torsion force. Pinning, single pin, 2, multiple pin, 3, spinning, 1, 2, 3. Tension band principle only. So in ICAR 2009 MCQ from this topic. So if I solve this topic, that is forces, intrinsic, here why it is because of body weight, muscle contraction, here avulsion. What was the fixation? Tension band, tension, and what force here? Force neutralized. That was the tension force. Muscles were pulling. This muscle contraction were pulling the bone, causing the fracture. We have five. We have best technique. One, two, three, four, five. Five forces, and we have technique like ESF, live plate to neutralize all the five. One IMP, two forces. More than one IMP, multiple IMP, three forces. Cross spinning, four forces. Like forces and their picture